In bright hospital hallways, doctors encounter routine illnesses every day. For the most part, they've heard it all before, seen it all before, but occasionally a patient comes along that leaves them utterly speechless. Today, we dive into the dramatic journeys of 3 such patients and uncover the horrifying truths behind each baffling diagnosis. From a man who woke up speaking a completely different language after a stroke, to a little girl whose body was slowly turning into stone. Our next patient is a 45-year-old man presenting to the emergency room disoriented and weak. He had just suffered a minor stroke but could be discharged later that day with medication and physical therapy. His prognosis was good, nothing to be too alarmed about. But when doctors tried to question him further about his symptoms, something strange happened. They couldn't understand a word he said. The man was speaking perfect French, not a language he knew. At first, everyone assumed it was a bizarre fluke, perhaps an elaborate prank. But as days passed, it became clear this was no joke. Doctors faced a horrifying truth. This man's entire linguistic processing system had been irrevocably altered. In fact, some parts of his brain had seemingly been rewritten entirely. So, what exactly had happened to this man? How could a stroke change someone's entire accent and vocabulary? And what does it reveal about the plasticity of our brains? MRI scans revealed a small lesion in the left temporal lobe, the area responsible for language comprehension and speech. Specifically, it affected Wernicke's area, which is vital for understanding the meaning of words. Damage to this region often results in a type of aphasia, a language disorder that impairs communication abilities. But this case was different. Typically, aphasia affects a person's ability to comprehend or produce language, but it doesn't alter the way they speak. This patient, however, now spoke perfect French, a language he had no prior knowledge of. This perplexing phenomenon is known as foreign accent syndrome, a rare disorder where individuals suddenly begin speaking in an accent that is not their own. While it has only been documented in around 30 cases worldwide, the underlying mechanisms remain unknown. Some theories suggest that the foreign accent is a form of phonemic paraphasia, where the brain struggles to accurately articulate words due to impaired connections between language centers. Others propose that it may result from subcortical damage to speech networks outside of the traditional language centers like Broca's or Wernicke's areas. This unique presentation highlights the complex interplay between different brain regions in shaping our linguistic abilities. As researchers continue to investigate this unusual condition, insights gained may shed light on the remarkable adaptability and intricate organization of the human brain. Further studies are needed to fully understand the causes and mechanisms underlying this syndrome. However, it serves as a reminder of the brain's complexity and its remarkable capacity for adaptation in the face of injury. Our next patient is a 7-year-old girl presenting to the emergency room with complaints of pain and stiffness in her ankles. Initially, doctors suspected she might have recently injured herself, perhaps playing too roughly at the playground. But the child insisted she had not fallen or been in any kind of accident. Physical examination revealed a horrifying truth. Her joints were fusing into place, locking her in a rigid posture. What kind of illness could cause a child's bones to turn against her, imprisoning her in her own body? This terrifying condition is known as fibrodysplasia ossificans progressiva, or FOP. It is one of the rarest genetic disorders on Earth, affecting only 1 in 2 million people. FOP is characterized by the abnormal development of connective tissues, causing them to gradually calcify and solidify into bone. This results in the progressive loss of mobility as joints and muscles become immobilized. The condition typically becomes apparent in early childhood and relentlessly worsens over time. Animation of how a single gene mutation can cause a protein called ACVR1 to malfunction and mistakenly instruct stem cells to develop into bone cells even when they should not be doing so. The protein normally helps regulate the formation and development of connective tissues like tendons and ligaments. But when it malfunctions, these tissues begin to ossify inappropriately, forming new bone in places where it's not supposed to be. This causes the affected person's muscles and joints to become stiff and immobile. Even more frightening is that any trauma or injury can accelerate the process. As a result, simple things like bumps, bruises, or even muscle strains can cause flare-ups where more bone tissue is laid down prematurely, making the condition rapidly progressive and devastating. Treatment options are currently limited, but ongoing research offers hope. Scientists are working to develop therapies that target the root cause of FOP, the misfunctioning ACVR1 protein. By understanding the molecular underpinnings of this disease, researchers hope to slow or even halt its progression, improving the quality of life for those living with FOP. Our next patient is a 26-year-old woman presenting to the emergency room in a panic. She describes terrifying visual distortions that have suddenly struck her down, rendering everyday objects unnaturally huge and small at random. At first, doctors believed she was having a psychotic episode, perhaps triggered by stress or drug use. But as these incidents continued, it became clear something else was happening. Horrifyingly, her brain was literally warping the fabric of reality, shrinking and enlarging objects according to its own internal logic. Doctors struggled to diagnose this inexplicable condition, which seemed to defy the laws of physics and biology. How could a person's brain spontaneously begin distorting their perception of reality? This strange ailment is known as Alice in Wonderland syndrome, named after the fictional character whose adventures in Wonderland are filled with sudden, inexplicable changes in size and perspective. In reality, though, there is nothing whimsical or fantastical about this disorder. Symptoms include objects appearing larger or smaller than usual, distorted facial features, and fluctuating body size. These symptoms are typically accompanied by severe migraine headaches, leading many experts to believe there is a strong link between migraines and the syndrome. One leading theory suggests that disruptions within the brain's visual and parietal lobes play a key role in generating these perceptual shifts. Specifically, abnormal signals sent from the eyes to the brain can lead to distorted perceptions of size, shape, and location. Other research indicates that migraines trigger the release of certain chemicals that affect how the brain processes sensory input, leading to the characteristic features of the syndrome. Neurologists are also investigating the potential role of genetics and other individual differences in contributing to the development of AIWS. Studies have identified several genes that may be associated with an increased risk of developing the condition, suggesting that a combination of genetic and environmental factors may be involved in its onset. While the exact mechanisms underlying AIS remain elusive, researchers are making significant strides in unraveling its complexities. By studying the neurological basis of this enigmatic disorder, scientists hope to gain a deeper understanding of how the brain processes sensory information and ultimately develop effective treatments for those who suffer from it. Now let's discuss some of the theories behind these frightening conditions. One prominent theory among doctors is that focal brain lesions are responsible for these strange phenomena. In the case of the man who woke up speaking French, a small tumor or damage caused by a stroke in the regions of the brain responsible for language processing could explain his sudden linguistic transformation. Similarly, the young girl suffering from FOP may have a genetic mutation causing her connective tissues to ossify abnormally. Any trauma or injury can then accelerate the process by triggering inflammation and tissue death, leading to the formation of new bone in inappropriate locations. Finally, the woman experiencing AIWS could have a neurological condition disrupting the brain's ability to integrate sensory information properly, leading to distortions in size, shape, and spatial awareness. When her brain processes visual input related to migraines, it creates a disconnect between what her eyes see and how the brain interprets that information, resulting in the unsettling perceptual shifts that characterize AIWS. All three cases highlight the incredible complexity and fragility of the human brain and body. Each patient presents a terrifying glimpse into the potential consequences of neurological and physiological breakdowns. While the specific mechanisms underlying each condition remain mysterious, medical science is continually advancing our understanding of them. Through ongoing research and investigation, we can hope to unlock the secrets behind these baffling disorders and work toward effective treatments and cures. Now it's time to hear from you. Which of these 3 cases terrified you the most, and why? Drop your thoughts in the comments below. I'll feature the most compelling insight in an upcoming deep dive episode.